everyone, it's Margaret Manning here. Welcome to 60 and Me. This is the place where women who are aging beautifully come to be inspired. Now, my guest today is Dr. Sarah Brewer. Dr. Sarah is trained as a hospital doctor and a GP at Cambridge University in the UK. And after her work as a GP, she realized that so many illnesses are related to dietary issues. So she's become very interested in self-help approaches to treatment and nutritional medicine. And her latest book is Eat Well, Look Great, which, by the way, is our mantra at 60 and Me, about looking as good on the outside as you feel on the inside. And this book is a great help for that. So welcome to the show, Dr. Sarah.
Hi, pleased to be here.
It's great to have you here. As I mentioned, our women in 60 and Me are totally focused on good health. And we asked them what questions they wanted us to put to you. And the one that came up next is honestly probably the one that's on most minds, and that is balance and not falling. You know, we know that the numbers are huge of people hurt by fall-related injuries.
Yes, that can be a problem, especially in people over the age of 75. And I mean, when I was working in hospital, we would often get GPs ringing up and saying, "Oh, could you see Mrs. So-and-so? She's off her legs." So there's this sort of phrase, "gone off her legs," which is sort of apocryphally used. But it sounds like, well, it's a serious condition because obviously it affects your ability to live on your own. As you've mentioned, injuries can occur. The number of elderly ladies that fracture their hip when they're rushing to get to the bathroom, for example, it makes you realise that something like a urinary tract infection can have these very serious consequences.
Yeah. No, we're very aware of that. And I would love to know what you think we can do to improve our balance, and maybe give us some thoughts on what we can do in our 60s and 50s, throughout our whole life cycle to make sure that we're better equipped to deal with balance issues.
One of the most important things is to maintain our muscle strength. Now, as we get older, and I hate saying that phrase, but it's better than the alternative. But as we get older, our muscles do naturally shrink down. And that's a condition known as sarcopenia, which is it's something that isn't inevitable. We can slow it, we can even prevent it by exercising and eating enough protein. So having a good protein based foods every day and exercising regularly every day. Now, I think the recommendation at the moment in the UK is to have at least 150 minutes per week of exercise. And that works out at about, half an hour to an hour on most days. And that is so important. Just simple things like exercise, walking briskly. And if you have to take a stick, then fine, do that. But don't think, "Oh, I can't go out because I've got to use a stick." Don't be worried about that. Just exercise and maintain that muscle strength. Exercising at home when you're sitting down watching TV, lift your legs up and down, bend your knees, stretch out your arms. And, this is also important because if your muscles are weakening and thinning down, then you are more likely to fall.
You talked about walking sticks, and I actually think you're right. There's people who do get nervous when they feel that they have to show their vulnerability, with the stick. But here in Switzerland, you see women all the time walking with their Nordic poles, with two sticks, and they're anywhere from 40s, 50s, right up to I've seen older women probably close to 80 or older, and they just do it with pride. They're kind of, I'm out here, I'm doing my walking, and their arm movement apparently is actually good for your muscles in your arms as well. Yeah. So,
and if you've got dodgy knees, which are a bit painful, then using sticks takes something like 30% of the weight off your knees. It's quite extraordinary. They really do help.
Yeah, so that's a good investment to make. And I know we've actually got some articles on Nordic Poles, so that's probably something you've probably written about too. You've written a book presumably about balance. It's in your...
I haven't actually, no.
Oh my gosh, there's 67, number 67 is there for you, Dr. Sarah. You can...
To the gap.
Well, it's important actually. And I think, like you said, it's related to so many of the things you do write about, like low blood pressure. I was reading that if you have, or you may not know you have low blood pressure, but that could make you a little less steady.
Well, most people, of course, have the other problem, which is high blood pressure.
Exactly.
So then you're treated with medication to bring that down, because that's so important to prevent long-term problems like heart attack and stroke.
Exactly.
But if your blood pressure comes down too low, or if you're on a diuretic, a water tablet, which affects the balance of electrolytes in your blood, then that can make you feel quite dizzy as well. So it is important, if you do know you've got a blood pressure problem, if you're on medication, then to have a home blood pressure monitor so you can monitor things.
Yeah.
Now, one of the problems as we get older, again, there's that phrase, when you stand up suddenly from sitting down, when you get out of bed in the morning from lying down, your blood pressure doesn't always immediately adapt to prevent you collapsing. And so when you stand up suddenly, your blood pressure can fall by as much as 20 units. So that's, quite a lot. And that can make you feel dizzy in the morning.
Yeah.
And the easiest thing to do there is to just get up slowly, swing your legs over the side of the bed and sit on the side of the bed for a few seconds, and then stand up. Little things like that can make all the difference.
You could do some yoga in bed. You could just do some stretches and just put your legs up and around and twist and turn before you slide out of bed. That's just get your blood flowing. Yeah. What about yoga? Are you a fan?
I've done it. I've even been to India on a yoga retreat once. It's not really something that I can claim to enjoy. I much prefer meditation to get calm, so I do meditate. I do a lot of walking. I don't do yoga at the moment, I'm afraid.
Yeah, but that's, we have a yoga program at 60andMe, a gentle yoga program for people who try to increase their flexibility and mobility. Yeah. And we have a lot of people saying that it actually does help their balance. And we have there's a part of the program which is about balance. Like doing the positions where you stand on one leg, and just close your eyes. That's a really simple, it's not so much a yoga position, but it helps.
Yes, no, that can help. Another thing is to make sure you get enough vitamin D. There have been several trials that have shown that people with low levels of vitamin D are more likely to fall. And it seems that vitamin D is involved in the immediate response of some very slow twitch muscle fibers, which if you're about to fall, you instantly sort of jerk yourself in order to get back on balance. Vitamin D is involved in that.
Yes.
So vitamin D levels are very low at this time of year because we don't have enough exposure to ultraviolet light from the sun in order to synthesize it in the skin.
Yes.
And also over the age of 60, you produce something like 4-fold less vitamin D than you would in your 20s. So it is something that a supplement is an excellent idea, certainly in the cold winter months. And in the UK, Public Health England actually advise everyone to take vitamin D supplements during the cold months. So that's something else to do. Obviously get out and get the sun when you can. Sensible exposure is also important, but consider vitamin D supplements.
And also your doctor can measure your vitamin D levels, can't they? It's one of those optional blood, is it in the blood test you would have it taken, or?
Yes. If everybody went and had it done, I think it would probably collapse the NHS because of the cost. So we're not
recommending that then. But still, if you are concerned and you think it might be low.
The easiest thing is if you think you might be vitamin D deficient, take a supplement.
Eat an orange.
Well, no, that's not really oranges. It's very difficult to get from the diet, vitamin D. You can get it from oily fish, so eating things like salmon, mackerel, herring, etc. Get it from eggs, and then fortified foods. Mushrooms are, if they've been exposed to ultraviolet light, then they will contain some vitamin D, but it's not the animal's type of vitamin D, the D3 that we need. It's the D2, which isn't quite as good. So lots of oily fish, and take your supplement, basically.
Those sound like really good pieces of advice. And I wanted to go back briefly to the comment you made about meditation, because I think that mindfulness and just being conscious of your surroundings is, a meditation for me has given me that skill to be, focused when I go out walking. Especially if you're traveling, I even do it, like you're looking around all the buildings and you don't notice the cobblestone. Just being mindful about your surroundings. Do you agree with that?
Absolutely, that's a very good tip. And also in your own home, make sure that you haven't got a mat that's got a curled up edge. It's little things like that which you can trip over. And keep a light on at night if you need to go to the bathroom, because again, your eyes take a while to adapt to get you there. So just making sure that everything is safe at home.
And also when you're out shopping too, I've almost fallen over a couple of times in these shops that have the floors are like white, like they're white color, and then they have a step that goes down, but they don't have a line across them, and you have to be so careful. I think it was even in Marks and Spencer's or somewhere like that, or H&M, but when you're shopping, be careful of steps, I think.
Yeah, and you can lose your depth perception a bit as well if you're wearing glasses, for example, and that can affect things. But, that's a definite health and safety issue.
Yeah. No, actually, when I almost fell there, I did actually tell them, and I think they did put like a yellow strip along there because
they certainly should have one. Yes.
Yeah. But again, you can't expect the world to take care of you. You have to be defensive, and not everyone's thinking of your best interests. So just think defensively, I guess, is the message. But so we got blood pressure. Get up carefully when you're getting up from bed in the morning. I actually written down posture.
Yes,
just being aware of your posture.
Yeah. Again, that's not something we can always control very well because we've got a tendency to osteoporosis. You can become more hunched, as you get older. So I guess that trains your eyes on the ground better, which may be a bonus. But if you are unsteady, do go and see your doctor because they can check your electrolytes. They can check to see if there's anything else going on that might be contributing to it. Yeah. And, if you've got a urinary infection, don't be embarrassed to go along and see a doctor because that, again, can affect you. And another thing that sometimes we pick up with people who come and saying they're dizzy is that they've got an irregular heartbeat. They've got something called atrial fibrillation. And again, that can, it's more common as we get older. There's that phrase again. Yeah. But an irregular heartbeat and the problems with the heart can also cause you to collapse, literally, and be dizzy and unstable. So do get a regular checkup and just make sure everything's going okay.
There's so many things. I was even thinking being hydrated, just like not being a little lightheaded by I don't drink enough water, and I know I don't. And whenever I remind myself about it, I think about balance because, I know the times that I feel lightheaded sometimes unstable or when I haven't had a really good drink of water that day. So anyway, this is amazing. I think we've come up with like 5 or 6 or more ideas here for improving your balance. And I honestly can't thank you enough for your insights. And I love the way you apologize for saying getting older. But you're absolutely right. We're 60 and me. We're trying to be at peace with this and be proactive. Which is what you're doing. So check out Dr. Sarah's website. It's drsarahbrewer.com. You're on Twitter too at Dr. Sarah B?
Correct, yes.
And do you have any other channels? Are you on YouTube or do you have an Instagram?
I don't really. I suppose, I don't know, I'm just too busy really. Busy writing. Yes, yeah. I mean, I don't Twitter as much as I used to. I used to be what was known as a power Twitter, I think. I used to be doing it all the time, and I've just had to let that go a bit because it just takes up so much. And
in case you missed the introduction, Dr. Sarah has written about 66 books. That's 2 6s, 66. And that's on just about every subject except balance, which she's actually going to start working on today. Thank you so much, Dr. Sarah. Great to talk with you. Thank you again.
Pleasure. Thanks, Margaret.
Bye. If you enjoyed this video, please subscribe to our 60andMe YouTube channel and also visit our website. We are a strong and dynamic community of women over 60. We're challenging aging stereotypes, and every day we share fascinating stories, interesting questions, and great conversation.